introductions. Will In introduction, respiratory problems are the most common cause of morbidity and mortality in the neonatal period. So when a newborn will have a irregular breathing patterns, that is fast and slow, and by observing them, we can know if the baby is suffering from any respiratory problems or not. So now we'll come to the anatomy of the respiratory. So here, these respiratory tracts are divided into two parts. That is, first one is upper and the lower respiratory tract. So in upper respiratory tract, we'll see the nasal cavity. You see the nasal cavity here. So pharynx, larynx, and in the lower respiratory tract, we have trachea, primary bronchi, and lungs. So definition, respiratory is in the newborn is recognized as one or more signs of increased work of breathing, such as trachypnea, nasal flarings, chest retractions, and gutting. So trachypnea, we all know that it's an abnormal rapid breathing, and nasal flaring is when the nostril widens while breathing. Okay, so the signs, most of the signs will be similar for respiratory problems, that is breathing rate, and the aspiration. So definition of the meconium aspiration is respiratory problems in a newborn who has bred meconium into the lungs before or around the time of the birth. The baby might inhale some meconium, which she or he might suffer from respiratory problems. So you can see the baby, the newborn. This is the inside the uterus. Fluid, the meconium. It is inhaled by the baby through the nose, and it will reach the trachea, and then it will be it will go to the bronchi and all. Then meconium will be present in the lungs. So this is a diagram for the meconium aspiration syndrome. Weight or post-term, and when the mother is having diabetes during pregnancy, so fetal hypoxia, low oxygen level, smoking during the pregnancy. In pathophysiology, you can see the first meconium aspirations, then airway obstructions will be there, surfactant dysfunction. As we all know what is surfactants, right? So it is a liquid made up of lungs that keeps the airway open. It makes the newborn to inhale oxygen, and it starts to make this surfactants starts from about 26 weeks of pregnancy, and then pulmonary inflammation will be there, and hypoxia acidosis. Hypoxia, as we all know, it's the inadequate oxygen in the brain. Acidosis is acid in the bloodstream. So then pulmonary hypertension. So clinical manifestation, trachea, trachea, nasal flarings, cyanosis, yellow-green staining of the skin, and nail beds, that is jaundice, dark greenish staining of the amniotic fluid. And treatment, in treatment, we have mechanical ventilation. That is, when a baby couldn't breathe by itself, there will be mechanical ventilation will be provided to the baby. So intravenous antibiotic may be given, IV, chest physiotherapy to help clear the lungs. And then the next causes is lung immaturity. So in lung immaturity, we'll come to know about the respiratory distress syndrome, that is RDS. It is a breathing disorder in newborn, which is caused by the immature lungs. When the lungs are not developed properly and the surfactant deficit, as I have already told, what is surfactants, right? So if there will be deficit less surfactants, then the baby won't be able to breathe properly, because surfactants keeps the airway open. Okay, so what are the incidents of RDS? So RDS is the leading cause of admission to the neonatal intensive care unit, and the severity usually increase during the first 48 hours of the birth. And what might be the causes for the RDS? It is mainly caused by the lack of slippery substance in the lungs called surfactants. So due to deficit of surfactants, they might have RDS. The newborn might suffer from RDS. This surfactant helps the lungs maturations process and prevents from collapsing. Okay. So babies normally produce surfactants between 24, as I have already told that the newborn starts to make surfactants at about 26 weeks of pregnancy. And what are the clinical manifestations? It might appear within minutes of birth, but might not be recognized for several hours. There might be rapid breathing, bluish color of the skin, and apnea. In diagnostic evaluation, yeah, we can see physical examination, chest X-ray, and we can see SpO2. How can we prevent? How can we prevent it? So, prevent premature delivery. Drugs to make the surfactant mature. That is, you can use aminophylline, and avoid drugs that cause respiratory distress and prevent asphyxia. So what are the complications? What are the complications for RDS? So infections, problem with the lung development and growth, hemorrhage from the lungs or brain, intraventricular hemorrhage. So now the next causes is congenital problems. So congenital problems, it can cause respiratory difficulty. This may involve the mechanical obstructions of the respiratory tract and abnormality of developed in the chest and its structure. So under congenital problems, we have upper airway problems and the lower airway problems. So in upper airway problems, the first one is corneal atresia. So it is a congenital where the back of the nasal passage. You can see here in this diagram. So behind the nasal passage, there will be blockage by the bony or soft tissue. Okay, so in this diagram, you can see the bone blocking nasal passage. Here. You can see, right? This is the normal, and this is the abnormal.
Yes.
So what are the types? Okay, there are two types, that is unilateral and bilateral. Unilateral, it is not detected until much, because the baby might get along with one nostrils. Baby might be able to breathe with one nostrils, and the problem will be seen after few years. And in bilateral, it is very serious because the baby won't be able to breathe directly. So at the time we can provide mechanical ventilation. And the upper airway problems. The second is cleft palate. This is the most common. So I think everyone know about cleft palate, right? So in cleft palate, it is the opening or split in the roof of the mouth and the lips. So there are three types. The first one is incomplete cleft palate. The second one is complete cleft palate, and the third one is submucous cleft palate. So the first one, a cleft is the back of the mouth, in the back of the mouth, in the soft palate, okay? And the complete cleft palate, cleft affecting the hard and the soft part of the palate. And in the submucous cleft palate, a cleft involving the hard and or soft palate covered by the mucous membrane lining the roof of the mouth. So in this diagram, you can see the unilateral, okay? It involves the lip, nose, and maxilla, okay? Roof of the mouth. So if a baby is suffering from, cleft palate, the baby will have difficulty in breathing. And while feeding, breastfeeding, it will be difficult for a mother to breastfeed because it will spit out. And this is the bilateral cleft palate. Okay, the it is the split and opening on one side of the lip that can lead. This one is the one side, and here the whole lips is involved. Okay. Bilateral cleft palate and unilateral cleft palate. So, what are the treatment that is to be given for this cleft palate? That is palatoplasty. And palatoplasty is done when the baby is about 10 to 12 months old. And then the third is laryngeal obstruction. So the first one is corneal atresia. The second one is the cleft palate, and the third one is laryngeal obstruction. So in laryngeal obstruction, it is a narrowing of the larynx. Okay, so narrowing of the larynx. So the presence of the cyst of laryngomalacia when the baby has a floppy larynx causing laryngeal tudor. And now we'll come to the lower airway problems. First, we have learned about the upper airway problems. Now we'll see for the lower airway problems. Esophageal fistula. Okay, it is an abnormal passage between the trachea and the esophagus. And hypoplastic lungs tissue that is not developed properly, and diaphragmatic hernia. Okay, it is a birth defect where there is a hole in the diaphragm. So we know that the diaphragm separates the chest and the abdomen. So the next is the central nervous system disorder. Newborn may show signs of respiratory distress with problems affecting the central nervous systems. So they might be as follows. First one is the hypoglycemia, is a low level of sugar level in the body. Okay. And it is the most common respiratory distress in newborn, which result in deprivations of the to energy to brain tissue, which can cause convulsion. And the second one is apnea, slow breathing. Okay, the pause in the breathing that lasts 20 seconds or longer for full-term infant. If a pause in breathing lasts less than 20 seconds and makes a baby heartbeat more slowly, or if he turns pale or bluish. So intracranial hemorrhage. Intracranial hemorrhage is that when there is a breathing inside a baby's skull or a brain. Okay, so it is a birth injury. It is a birth injury, maybe due to birth trauma while delivering the baby might have get hurt from the skull, maybe may have injured. So perineal asphyxia, it is a medical condition resulting from deprivations of oxygen to a newborn infant that lasts long enough during the birth process or to cause physical harm. So the next is the cardiovascular and circulatory problems. When there is a change of circulations in the birth during birth, then certain cardiovascular problems may be faced by the newborns. Okay, so the first problem is the patent ductus arteriosus. So the PDA, the ductus arteriosus, fails to close, causing blood to be diverted from the lungs. In normal neonates, it is functionally closed by about 12 hours of age. This patent ductus arteriosus is a heart defect caused by the problems in the heart development. Okay, so in the when it is an opening between two blood vessels leading from the heart. So too much of blood flow to the baby's lungs and heart, the baby might suffer from this one, neonatal hypertension. Okay. So what are the risk factors? Mm, Risk factors are premature birth, genetic conditions, rubella infection during pregnancy. So the clinical manifestation are tachycardia, murmur, sweating. So murmur is the sound of the blood flowing through the heart. Okay. What may be the complications? So high blood pressure in the lungs, heart failure, heart infection, that is endocarditis. How to prevent it? Seek early prenatal care even before you are pregnant. Eat a healthy diet, avoid infection. What are the treatment? So in medications, we can give non-steroidal anti-inflammatory drugs, and surgery is wet surgical ligament. Wet surgical ligament. The second is the persistent pulmonary hypertension of the newborn. So it can